Hey everybody, it's Katie Harris, owner and nurse practitioner of the Philly Wellness Center. And as many of you know, we deal with hormonal issues for menopausal women, but also other issues. And so one of the hormonal issues that I want to talk about today is polycystic ovarian syndrome. And polycystic ovarian syndrome, it's truly a misnomer in so many ways, because only a third of women who actually have polycystic ovarian syndrome, or PCOS, actually have cystic ovaries. It's what it is that it is a metabolic disorder, and it's insulin resistance. So the way to treat polycystic ovarian syndrome is largely diet, and staying away from processed foods, because the insulin surges are what is actually causing the issues in the first place. So let's talk about it. First things first, what exactly is polycystic ovarian syndrome? It is a condition that primarily affects women's hormone levels, and it is the leading cause of infertility. But it's much, much more than that. It's more than a reproductive issue. And like I said, that's a complete misnomer, because it is a metabolic condition, and it should be treated as such. It affects many, many systems in the body. So let me break this down. Normally, the ovaries produce estrogen and progesterone, which help regulate your menstrual cycle, and they help with ovulation. So the release of an egg during the cycle. So in women with PCOS, though, there's a hormonal imbalance, and the main culprit behind this imbalance is insulin resistance. So insulin is that hormone that helps to move sugar, your glucose, from your bloodstream into your cells, where it's used for energy. But when the body becomes resistant to insulin, which often happens due to poor diet, lack of exercise, or other lifestyle factors, your cells no longer respond properly. So instead of sugar moving into the cells, which it's where it's supposed to do, it stays in the bloodstream. And so the body's like, oh no, I need to do something with it. Insulin gets produced even more. The more insulin you have, and if the cells aren't taking the insulin, what does insulin do with it? It has to store it somewhere. You can't have too much blood sugar. If you have too much blood sugar, you end up in a diabetic coma, you die. This is a lethal situation. So insulin comes to the rescue. What does it do with insulin if it can't get it into the cells? It drives it into fat. Okay, you have an unlimited capacity to store fat, and it stores it as visceral fat, which is the really, really bad fat. So here's what things that can go wrong for women with PCOS. Excess insulin doesn't just affect your blood sugar, it also disrupts your hormones. Too much insulin stimulates the ovaries to produce more testosterone, which is normally a male hormone. It's present in women. Actually, women, there's like 3,000 functions of testosterone. Testosterone is your dominant hormone, and it does produce estrogen in small amounts. But there has to be a delicate balance, and that's what the body's always trying to do, is delicately balance the hormones. So you have a balance of estrogen and progesterone, and testosterone. But now when you have more testosterone, it throws off that delicate balance, and it becomes extremely problematic. So as a result, women with PCOS don't ovulate regularly, sorry, which can lead to the formation of cysts in the ovaries. And those cysts are essentially eggs that never mature, and they're not released because the hormone balance is off. So over time, this leads to irregular periods, and in many cases, infertility. So what are the symptoms of PCOS? The most common ones are irregular absent periods, difficulty getting pregnant, excess hair growth, especially on the face, and that's the excess testosterone. Testosterone helps with hair growth, which is great if you're losing your hair. It's not great, if you have excess testosterone as a female, because it will grow hair on your face and in places that you don't want. It's a more masculinization, because you have more testosterone than you need. And then it also causes acne or oily skin. So you have sebaceous glands that are overproducing, and many women with PCOS get that cystic acne. And then, so it affects, PCOS affects more than just your ovaries. It's, the ovaries are actually kind of I don't want to say minor, because it's not a minor issue, but it's one of many bigger issues of what's going on. PCOS is not just a reproductive issue, even though only OBGYNs seem to deal with it. It is a metabolic issue. It should really come under the realm of your endocrinologist. But And it's directly related to conditions like diabetes, type 2 diabetes, because both of those conditions involve insulin resistance. The high levels of insulin circulating in the body not only disrupt your hormones, but they also increase your risk of long-term health issues, heart disease, cancer, and of course, diabetes. So if you have PCOS, you're on that pathway. The good news is that PCOS is reversible, and many women who have successfully managed their PCOS symptoms even have restored their fertility by just addressing that root cause. And that's what we want to get to. The root cause is insulin resistance. PCOS is insulin resistance, okay? As nothing, fixing your ovaries isn't the issue. Fixing the insulin resistance is what we need to do. Studies have shown that focusing on dietary changes by improve insulin sensitivity, women can dramatically improve their hormone balance in as little as 12 weeks. So one of the most effective ways to combat PCOS is through dietary intervention, especially a ketogenic diet. These diets help regulate blood sugar levels and reduce insulin spikes, allowing the body to restore naturally. In fact, research has shown that women with PCOS who follow a ketogenic diet can often regain their ovulation and fertility without the need for invasive treatments like IVF, right? So wouldn't that be great if you don't need IVF? I went through IVF myself, and it's not the best experience. It's not pleasant. So if you can get pregnant without IVF, that's all the better. So let's talk about why this approach isn't widely recommended as it should be. So unfortunately, many doctors, nurse practitioners were not trained to look at PCOS through the lens of metabolic health. When I learned about PCOS, it was during the very short window where we studied women's health, and we did an OBGYN rotation. You learned about PCOS, but you don't really learn about the root cause. You just learn, oh, this person's been diagnosed with PCOS, so let's give them metformin. Right, so there's always a pharmacological solution to diseases that we can label. So that the pharmaceutical solution for PCOS is metformin, which is a diabetes drug, and it's meant to stimulate ovulation without ever addressing the problem in the first place, which is the insulin resistant. So you need to solve insulin resistance, and metformin is just like putting a Band-Aid on. It does help. It absolutely helps, but it's not solving the problem. We have to solve the problem. And while we're solving the problem, yes, metformin is extremely helpful, but no, it's not the answer. There's another tool that can be really, really helpful for women for PCOS, and that's your continuous glucose monitoring devices, or CGMs. These devices allow you to track your blood sugar in real time, helping you to see how your diet and lifestyle are impacting your insulin levels. So many people aren't offered this unless they're in late stage diabetes. Certainly here at the Philly Wellness Center, we can order these for you if you're our patient. And it's really, really helpful to keep track of your blood sugar, and you can see how your blood sugar reacts to anything that you eat in real time. It's an app, it's on your phone, and you can, you go to Starbucks and you get a triple shot latte with all kinds of shots and sugar pumps in it, and you're going to watch your sugar level skyrocket, right? And that biofeedback, that feedback helps you to say, you know what, I'm not going to do that, because now I know my insulin levels are going up, and if my insulin goes up, what happens? Your fat is going to go up. It is going to store all of that stuff as visceral fat, which causes all kinds of problems. You end up with fatty liver. You end up with all kinds of abdominal problems. You can store fat in muscle. You can store fat. You have an unlimited capacity to store visceral fat. So the CGMs can help keep your blood sugar stable and help you heal PCOS naturally. So thousands of women have used dietary and lifestyle changes to reverse their PCOS, and many have gone on to have healthy pregnancies without needing costly and invasive fertility treatments. So this is possible. We know this is possible. So what is the takeaway here? PCOS is a condition that affects your whole body and not just your ovaries. I mean, the good news is that it's also highly treatable with the right approach. By managing insulin resistance through diet, exercise, and tools like glucose monitoring, many women can regain control of their hormones, their health, and their fertility. So we can help you at the Philly Wellness Center. So we do specialize in hormone therapy and all hormone therapy. Okay, we can help you to reverse PCOS, to lose the weight, to balance your hormones so that you can achieve whatever whatever health goals you need and want to achieve. So thanks so much for watching. If you found this video helpful, please give it a thumbs up and subscribe for more content on women's health, hormone balance, and metabolic health. And if you're dealing with PCOS, remember you have the power to take control of your health. Stay informed, stay empowered, and book an appointment with us at the Philly Wellness Center so that we can help you, and we'll see you the next time.